Welcome to Vetted Health News. I'm Dr. Felicia Stoller. Vetted Health News is a multimedia brand providing health and lifestyle news that is entertaining, but more importantly, it is substantiated by science. Our mission is to critically examine and deliver unbiased health, medical, and lifestyle information with the same journalistic integrity as hard news, politics, and current events. You will find us here each week giving you the skinny on topics that affect our lives. Each show has recurring segments exploring mental health issues, the politics of health, common health myths, and even the utterly ridiculous as it relates to your health and well-being. We want to hear from you. Send us questions or comments about something that you'd like us to discuss or explore. We'll highlight topics important to you, so reach us via Twitter, Facebook, or through our website. May is Exercise is Medicine Month. Exercise is Medicine, or EIM, was started in 2008 by Dr. Robert Salas of Kaiser Permanente while he was president of the American College of Sports Medicine.
Having been a family physician for many years, I really just saw firsthand how powerful an effect that exercise had on my patients. And at the same time, going to the ACSM meetings every year, I would see research presented on the health benefits of exercise, and it just seemed ridiculous that we weren't trying to leverage that in healthcare, that as a family physician, I wouldn't be prescribing that to my patients like it was a drug, because certainly if I had seen the studies I see on exercise being presented on a medication, I would be all over prescribing it, and it would, in fact, it would be malpractice if I didn't. And
Right.
So why was that not happening in healthcare? It didn't make any sense to me. And so that was really what we wanted to achieve. The really goal for me was I felt like every doctor should ask their patient about their exercise habits. Just like they ask them if they smoke, just like they weigh them and mention if they're overweight, they're required to put that on the chart. It makes no sense that we leave out exercise.
Exercise is Medicine is a collaborative effort between the American College of Sports Medicine, the American Medical Association, and the Office of the U.S. Surgeon General, just to name a few. And their message is clear: Americans need to move. Despite the idea that we are designed to move, people are doing less of it.
We use the word exercise versus physical activity for those that are not athletic and or maybe not coordinated, who might find organized sports to be somewhat challenging.
Absolutely. It doesn't have to be a formal program. We know just getting out and moving, whatever it is you like to do, but we got to get kids to do something.
Right.
And I think certainly we've engineered physical activity out of our kids' lives. We've engineered it out of our own lives, the adults, all the adults, and really now being active is a chore. It's a pain in the ass to be physically active. It's not the easy thing in life to do, because it's much easier to take the car. You have parking spaces very close. Usually public transportation is just not functional, in most cities.
Right.
So you have to have a car. You have to rely on it, and most people have sedentary jobs. And so to be physically active, you often have to leave the house and go to a gym, which a lot of people, if you're a single parent of 2 kids, when you come home in the evening after a long day of work, it's a pain in the ass for you to get to the gym probably and to work out. So we've made it very difficult, and I just think we have to work to make it easier. I think that's where the solution will lie.
We have so many tools created to make our lives easier, so why and how did we engineer exercise out of our lives when we allegedly have more time?
That at the end of the day, we all know we should be doing it, but it gets pushed out of my schedule because so many other things just can't go away. The caring for the kids, going to work, keeping up with the house and chores and paying bills and all of those things that we absolutely have to do. The physical activity is one that tends to get pushed away. The other thing is I think people get a little bored with it. Most of us now the quickest thing to do with exercise is just go to the gym and get on the treadmill or get on a stationary bike or an elliptical, and that's boring.
Right.
And I think most people, it's not a social, fun thing to do.
Right.
And so I think, I don't really enjoy it that much. I don't have time to do it. And we just develop these sedentary habits. And so I think those are 2 of the areas that are the most ripe for change. Making physical activity, part of your daily routine, and that to commute. We certainly know that people who live in a city like New York City, where it's got great public transportation, you have to walk.
Right.
It's easier to walk than take your car. And you don't even want to have the car.
Right.
So creating those kind of situations where, I'd rather drive my car, but it's a pain in the ass. It's easier for me to walk,
Right.
and you get the exercise you need. Or, and the other big one I think is why does it have to be just drudgery? Why, when we were kids, if I asked you, I'm sure when you were a kid, what was your favorite subject? You probably said recess,
Right.
closely followed by PE. And,
Right.
how did it go
I
from
want to
the
play kickball again.
Exactly. So why can't we? Why did it go? How did it go from the favorite part of your day to now something I got to talk you into doing? Well, I think because we made it not fun. So why can't we bring socialization back? And so I love the power of social networking to bring people together around physical activity. That's what's going to take, I think, a smart person who's real tech savvy to figure out apps and social interactions that allow people to connect for walking, jogging, hiking, whatever it is you like. It'll make it easy to, there's somebody else who lives in your neighborhood who actually might become a good friend because you both need to go walk or walk your dogs or walk your kids in the stroller. How do we get those people connected so it's a social thing? And it's actually, I'm not doing it for exercise, I'm doing it for the social interaction.
Right.
I think we got to disguise exercise in fun, and we've done a poor job of that.
Not all primary care or family physicians really understand the health implications of exercise.
Exercise is the single best vital sign of how you're doing. It takes into account multiple organ systems. And if you're able to be walking 30 minutes a day, that's a great indicator of the level of your health. Now, obviously, self-reporting things is often inaccurate. We know, if I ask you how many cigarettes a day do you smoke, or ask you how many drinks do you have, it's always going to be lower than it is. If you ask a woman how much they weigh, they'll always say less than they do. If you ask a man how tall he is, he always says more than he is. But so we know self-report is fraught with error, but at the same time, it's at least a starting point. So that's what we use an exercise vital sign at Kaiser, where every patient is asked how many days a week are they exercising, and on those days, on average, how many minutes. And the computer then multiplies those two responses together. So it's self-reported on their chart every visit, regardless of the provider they see.
Mm-hmm.
And the starting point to at least launch into the discussion. Either, hey, good job, I see you're doing 150 minutes a week, keep it up, or today I notice your blood pressure is high, you report you're not doing any exercise, there's a connection there. Before we just jump right to medication, why don't we try getting you to walk? That's all we're trying to do with it. And from that standpoint, I'm not even really, I don't really care how accurate it is. In my mind, if my patient budges it to me, I believe that when they go home, they're going to say, oh, wow, I told them I was exercising 30 minutes a day. I better do that.
Right.
So it's just a starting point. But I think in other patients, it really could be a critical value because we know that, for instance, patients with end-stage heart failure or lung disease, just doing a little bit of activity has a powerful effect on their functional capacity and on how long they're going to live.
When it comes to managing healthcare, physical activity can predict the level of care needed.
I know when a patient with heart failure stops moving, they're going to soon be admitted to the hospital.
Right.
And so I think I can use it to head off disease. I think it can be a very powerful tool for predicting, hospital admissions, survival, and a way to keep people out of the hospital and ultimately save money. I think there's a ton of value there, and we're doing some studies at Kaiser really using this as a therapeutic intervention and as a predictor of who's going to get admitted to the hospital to try to prevent those hospital admissions.
Right now, medicine is all about treating illness versus prevention. Kaiser Permanente in California has a different approach that other healthcare systems can learn from.
I see it that there's an investment in prevention, right, to keep other more expensive costs down, where everybody talks about healthcare costs escalating, and you really get to do primary preventative care, right?
Yeah, exactly. So Kaiser Permanente, where I've practiced my entire career, is what we would call a staff model HMO, health maintenance organization, where patients pay us each month. We take care of all their health care. So there's no insurance company. We are the insurance company and the healthcare system. The Kaiser Permanente health plan enrolls the patients, and I'm a partner in the Permanente medical group. Mm-hmm. We take care of the patients, and then we have a hospital group that provides the hospitals. So our incentive, unlike most healthcare organizations around the country, is not to do procedures to people. It's to not do them, to keep them healthy. The healthier they are, the longer they live, the more money we make. And really, that's how healthcare needs to be. we simply cannot continue to just reimburse physicians on what they do. That the more heart stents they put in, the more money they make. They should lose money when they have to put a heart stent in.
Right.
They should make money when they don't have to put one in. When the patient is healthy enough, they keep them healthy. They treat their blood pressure, cholesterol, blood sugar, those types of things, keeps it progressing to that. They should make more money. When you have to go to a heart stent or bypass surgery, that's when you should lose money for that. It shouldn't be a money generator, because we're in a system now where the way to make money is to do things to patients. And then we stand back and wonder, why are we doing so many heart caths? Well, it's because that's the thing that makes money. The cardiologist makes no money if he prevents it.
Right.
And that's simply got to change.
Change takes time, even when we know the right thing to do, as with smoking.
If you look at where we were with smoking, in the mid 60s was really, that's when we doctors first began to tell patients in a clinic setting, you should stop smoking. And really, we didn't ramp that up.
They were smoking outside themselves,
a lot
right?
of them were. I mean, doctors regularly appeared in cigarette ads. And,
Right.
So it took a good 20 to 30 years. Really, 2004 was a tipping point for cigarette smokers, where that was the first year that the number of ex-smokers outnumbered the number of current smokers. So we clearly have had an effect. We've seen smoking rates drop from 40% of the population to less than 20. And in about 20, but it took about 25 years to 30 years.
Dr. Salas was quick to point out that exercise needs to be our go-to treatment.
I think exercise from every disease is the first line substitute. I don't care if you're talking about depression, if you're talking about pain management.
Mm-hmm.
We know that those with chronic pain who exercise need much fewer narcotics or don't need them at all.
Right.
And so it has to start with that.
Medical schools need to do a better job of educating physicians about behavioral interventions and not just pills.
I feel like in healthcare we are so owned by pharma. We really do what they tell us to do. When there's an initiative comes up, it's usually funded by pharma. The big one now is the push for screening everybody for hepatitis C. These new hepatitis C drugs cost $80,000. And the pharma companies are funding a huge push. Let's test every adult,
Right.
so we can make 80,000 off them, and it's just on and on and on. And I think it's time that healthcare and medical education, postgraduate education, we need to break away from pharma. It needs to focus on non-pharmacological measures equally, or if not more, than as the mainstay of treatment. It cannot begin and end with drugs. I don't care what the condition is. And that's often the state we're in today.
And now, Psych Watch. This week, we are taking a look at how physical activity and exercise impact mental health and learning. Once more, we turn to esteemed family physician and friend, Dr. Bob Salas.
We've developed other programs like the Exercises Medicine on Campus, which I think has got tremendous potential. I'm just really amazed at how we've let physical activity go away in schools. At the same time we were battling with schools to take out sugary snacks and beverages out of the vending machines. We got that done, which was great, but they took PE at the same time and we didn't even notice.
Right.
And so I really felt like that happened on our watch, and that's something we need to reverse, starting with the colleges and universities, where most schools now you can't even take PE for credit.
Right.
I think it's crazy.
I had to.
Yeah,
I had to take 4 semesters of PE in college. My father's like, "What? I have to pay how much for you to take PE in college?"
They're probably the only things you remember. I bet you remember more of the PE classes that maybe you learned how to play.
Well, I don't want to tell you what I got to take for PE. I took ballet, 2 semesters of sailing, and golf. It was like my Club 101 classes.
You probably use the sailing class more than you use your algebra class. I'm willing to bet these days. So.
Yeah.
I think what we put an emphasis on, and I just saw just across my desk off of a Twitter feed the story that came out of Canada. We're killing our kids with too much math and not enough PE.
Right.
And it really is true. I mean, we just go nuts on the academic side of it, and we continue every time the scores are low. The knee-jerk reaction is, let's add more math to the curriculum. And what do we take away from? PE.
Right.
And that just doesn't make sense, because you cannot simply chain kids to a desk all day and think they're going to learn more. Right. I think we all know that if we get them out of the classroom and have them exercise a bit, they're much more focused when they're there and they learn more. We have study after study showing that kids who are physically active do better on standardized tests, do better in school, less behavioral problems, and we simply ignore them. And
Right.
it just doesn't make any sense.
Yeah, I was just down in Washington with ACSM doing some advocacy work with the SFIA, and there was a guy there from Cooper who was bringing along these, brain scans that they had of children showing that kids that exercised for I think almost 20 minutes a day had way more activity in their brain that, they were able to say, hey, look, this helps kids to learn better. So not just kids, think about adults and being productive in
Absolutely.
work,
Yeah.
or whatever it is that we're supposed to be doing day to day.
Yeah, I mean, we know that exercise releases the hormone BDNF, the brain-derived neurotropic factor, which is like a miracle grow for the brain.
Right.
We have studies that show we actually see brain growth in kids and adults
Right.
who do regular exercise, not just, primarily in the hippocampus, but in the white and gray matter, all enlarge. It's like a muscle.
Yeah.
And the way you exercise the brain is not thinking more and studying more. You exercise it by doing physical exercise.
Right.
And I don't understand what we're waiting for, what more evidence we need that all kids should be doing regular physical activity, that it should be part of their curriculum in the schools and their after-school program. I mean, we've got to somehow figure out how to do it and then try to keep it going into adult life.
Right.
But we know that kids who don't exercise much more likely to be adults who don't exercise.
When it comes to the numbers, there is more than meets the eye. Today's Quack Quack segment poses the question, can you truly rely on the numbers on the cardio equipment at the gym? I recently had the opportunity to discuss these questions with my friend and colleague, Dr. Sean Arendt, Director of the Rutgers University Center for Health and Human Performance.
If you have no other resources, using the approximations on the equipment is fine,
Right.
but don't count on them being perfectly precise, especially if you don't put your own weight in. And the other thing people have to remember is every time they go and grab those heart rate handles,
Right.
they're actually reducing their heart rate because they just made the exercise easier while they're doing it.
Right.
So as long as you're hanging on,
Right.
and it's funny because you see people using equipment like that, right? Like they're
I see
walking
people
the
just
same-
holding on for dear life, even
Oh
when
my
they're
God.
doing, and I just
Yeah.
want to if you're holding on, then change the incline or the speed or something, because, that's not the way to do it.
No, and that's really where you throw the calories off, because the treadmill is just registering you're hauling butt at 4 miles an hour on a 15% incline.
Right.
And it's like, wow, you're cranking out. But the thing is, you're hanging on.
Right.
So it's not as hard as if you let go. And so then the calories really are not accurate in that case. So the calories are mostly accurate or a good ballpark if you're doing it the way you're supposed to do it.
Right.
Other than that, not so much.
Okay, so then the other question that I have for you is all the devices and all the technology that we have, helpful, hurtful, reliable, good enough for most of us?
I think reliable is an interesting question. There's most definitely some pieces of equipment that are better than others. And I think I generally like the idea of activity monitors, activity sensors, because I think for some people it's useful feedback. It encourages them to move, especially all of a sudden you have your watch beep at you and it says, you've been sitting, time to move. I think there can be useful reminders. I think it can give people a target to try to achieve. So I think that's good. It'll help you basically record whether you're progressing or not. So I think that's good. But at the end of the day, I think some people become a little too wrapped up in it. And to tell you the truth, some equipment is better than others. There was a couple studies that just recently came out showing how accurate different brands of fitness trackers are, and they're not all equal. I think when you see these labels on the cardio equipment and it says fat burning zone, cardio zone, they're fairly disingenuous. They don't really, people think, if I'm in this particular zone, I'm burning more fat. As a percentage, sure you are, but as a total number, no, you're not. So if all things are equal from the standpoint of duration, so let's say, for example, you're going to be on the treadmill for a half hour, intensity always wins. So the higher the intensity, the more calories you burn. The more calories you burn, the more fat you're technically burning. And I think
But are you burning it in that moment? This is what people always want to know. And I know the answer, but I want you to tell it.
Yeah, and I think the problem is I think we get caught up too much in how many calories did I burn in a workout. And the reason is they're forgetting about what goes on afterwards as well. So if they're only focused on what happens within that 20, 30, 40 minutes, they're missing the effect that it has metabolically, for a residual period of time after. Well, you're basically continuing to make the metabolic adjustments that occurred and try to get back to normal, to homeostasis. So just focusing on that number can be really deceptive. And I think the problem is if people just think that, well, if I do a lower intensity and stay in this zone, I'm burning more fat. If I get to this higher intensity, then I'm training cardio. Well, technically, even at the lower intensity, there's cardiovascular involvement. And at the higher intensity, there's fat involvement. So I would say stay away from those zones as your true indicator of what you're doing. Generally speaking, it really comes down to what your goals are in terms of what you're trying to accomplish from a fitness standpoint. Now, that being said, the next part of that becomes, okay, then how many calories am I burning? And is what the treadmill says accurate? Generally speaking, the more information you give the equipment, the closer those calories will be to real. Okay, so in other words, if you insert, if it asks for height and weight, especially weight,
they only ask for weight. They never ask for your height or
yeah, and so if it's just a generic number and it says, oh, you burn this many, all that's based on is metabolic equivalence. So in other words, there's a certain effort level associated with that particular speed or incline. So what it's assuming is that this much above resting is how much it's changing your metabolism. So that directly ties to oxygen consumption.
Right.
The problem is if it doesn't know your weight, all of that caloric expenditure, especially on something like a treadmill or a Stairmaster or an elliptical, which are body weight exercises. In other words, they're not supporting you. Your body size factors in. What's happening is that's not an accurate estimation of how many calories you are burning because it's basing on an average. So for example, if it's basing on, say, 130 or 150 pound individual and you weigh 210 pounds, you're going to be burning a lot more calories than what that number suggests, and vice versa if you're much smaller. Right. But it does give you a rough approximation of the intensity at which you're going because it is based on a general metabolic equivalent. But is it a precise number? No. Is it ballpark? Yeah, it's ballpark. And like I said, the more information you give it, the better. To me, it's always one of the reasons why I would far prefer to rely on a heart rate monitor, because here's the other trade-off is unless you're using the heart rate sensors on the treadmill, it really has no idea how hard you're working as a percentage of your maximum. So if your own VO2 max or aerobic capacity isn't factored into this, it's an extrapolation of oxygen consumption, and it's calculating about how many calories you're using. Like I said, it's still probably better than nothing, but I think it gives people a false sense of security because they assume, well, I burned 520 calories. It's probably more like somewhere between 460 and 580, depending on your size. So it's not giving you perfect information. The upside to using some of the better heart rate monitors is you insert things like your height, your weight, your fitness level, your VO2 max, all these other values that your resting heart rate, all these things that can be used to give you a better estimation of caloric expenditure. And there's some really interesting studies showing that heart rate monitors do correlate with oxygen consumption, which ultimately is your measure of caloric expenditure. Right. That's ultimately what's telling you how many calories you're burning.
In our Weight of the Nation segment, I'd like to address the ways that people can make a conscious effort to move more and sit less. After all, sitting has become the new smoking. I recently spoke with a gentleman who asked me if he could keep off his weight loss with diet and food alone. He no longer wanted to exercise. When I asked him why he didn't want to exercise, his answer was, because I'm bored with it, it takes up too much of my time, and I simply just don't like doing it. I told him that exercise is not just about body weight. It helps to keep the heart in good shape, lowering resting heart rate, lowering blood pressure, and decreasing cholesterol. It puts glucose into cells, it helps with stress and sleep, keeps muscles strong, and maintains bone density. The man smiled and said, I guess I'm just going to have to keep doing it. I reminded him that moving around throughout the day does count. But since his new habit helped him to lose 100 pounds, he should continue doing it. When I completed my research for my doctorate in worksite wellness, in addition to physical activity trackers, we suggested to our participants that they each take a 5-minute walk every hour. For someone who works an 8-hour workday, they would be able to accumulate 40 minutes of physical activity. Seems simple enough, right? Instead of thinking about getting your fitness completed in one bout, do it in smaller batches throughout the day. Just remember, it all counts. This week in our Politics of Health segment, we're going to discuss the idea of towns and cities being fit and even conducive to physical activity. Each year, the American College of Sports Medicine reports its American Fitness Index. Dr. Walt Thompson, Associate Dean for Graduate Studies and Research at Georgia State University, and the incoming president of the ACSM sat down for discussion with me to discuss this rating program.
A process called a Delphi technique, which identifies what experts believe to be the most important parameters to measure in communities that would give us both an idea of who lives in the cities and how healthy they might be or how fit they may be. But more importantly, which makes the American Fitness Index unique, is that we also look at the community. So we have two of these factors working simultaneously. One, what we call personal indicators, and the other are what we call community indicators. So basically, Felicia answers the question, if I want to be healthy and I live in one of these cities, does my environment support me being fit?
So for the average consumer, let's say I live in a rural area or I live in a suburban town that doesn't make your top cities list. How can I take that information and use that to help improve the quality of living and life in my community?
That's a great question, and a question that we were asked as early as 2008 when we launched this project. The question is, I don't live in one of the 50 most populated cities in the country. How can I make some significant comparisons and then create change in my community? So we developed what is called MyAFI, My American Fitness Index, MyAFI. And if your listeners will go to the AmericanFitnessIndex.org website, they can click on a tab that says MyAFI, and just simply adding some numbers that you can get from your community and community leaders, Park and Recreation Association, is a great place to start. It's just simply plug in those numbers and it will give you a score for both these community indicators and these personal health indicators. And then you can have your own score for your own rural town or suburban town. It doesn't matter how big your community is. By using the MyAFI tool, you'll be able to see how you can compare against all of the other cities in the country.
It does help that Dr. Thompson lives in Atlanta and his own city makes a great example. The myths surrounding exercise and physical activity are many. One of my favorites, spot reduction. Yeah, you know what I'm talking about. Walk past any magazine rack and you'll see titles promising to melt belly fat, trim thighs, and give you six-pack abs. I asked Dr. Sean Arendt about whether or not this is true.
Yeah, actually there is. It's called liposuction. So if you want to just get rid of fat in a certain area, just get it sucked out.
Right.
Without getting too much into the mechanisms, the part that people miss is that a lot of it's hormonal and enzyme controlled. So we have certain responses that allow for fat to be mobilized or not. And unfortunately, in areas where people tend to store their fat, in females it tends to be more in the lower body, gluteofemoral region, in guys more central in the stomach. That tends to be where you have high what we call lipolytic or LPL activity from the standpoint of lipoprotein lipase to allow for fat storage. If you can't mobilize it, you can't burn it in that area. And I think what people need to understand is, look, you can do all the crunches and ab work.
If you do like 1,000 crunches a day, right? You're going to have that six-pack, right?
Yeah, and at the end of the day, you may be trying to get a six-pack, but if it's covered with a layer of fat, you just got a keg. Right. So it's not really like you can't selectively chisel. Now, that being said, don't get me wrong, like one of the best ways to not so much spot reduce, but spot enhance, it's clearly lifting weights, because it's sort of like sculpture, right? You add muscle in certain areas and you lose fat in others, and you change the look of the physique. So there are ways to modify the physique, but to just try to target one area for fat loss really doesn't work. The only thing that would work would be, potentially some creams that contain thyroid hormone that's been shown to mobilize specific fat cells in the area, but that's not FDA approved.
Right.
So you're not talking about anything that legitimately just targets that area.
Right.
And people can wear all the sweatsuits and those rubber suits and the squeams and all the other crap they want. It's not going to change the fact that you're still storing fat there. And I think when people have what they consider to be their problem areas, you're going to notice other areas getting leaner first. And honestly, it may take quite a bit before you finally get rid of that kind of problem area that allows you to get that look that you want. And, you know, in many cases, you can blame it on your parents because a lot of that is genetically determined, right? So I think that's
another reason to be in therapy.
Yeah, exactly. You know, and I think the example I use for some of my students in class too is if spot reduction really occurred, cyclists would have big fat upper bodies and these super tight legs. And
Right.
bottom line is they've lost fat all over. They're very lean, period. So
Right.
it's
Right.
not just the limbs that you use or the body part you target. It's all over, you know, and that's where it's going to be mobilized when all is said and done.
Our tweetable of the week at Vetted Health News, hashtag EIM News. I exercise because. And you tell us why. Now, we'd love to hear from you. We want you to be involved by leaving a comment below or reaching out to us on social media via Twitter or Facebook. The best discussions happen after the episode is over at vettedhealthnews.com, so go there and leave a comment now. Did you like this video? Yeah? If so, subscribe to this channel and share it with your friends. I'd like to end by saying the healthy choice is the easy choice. You just have to make it.